Uganda has made significant strides in the fight against HIV, saving millions of lives through expanded treatment and prevention efforts. Yet with more than 1 million people still living with the virus, advocates warn that stigma and fear remain major barriers to ending the pandemic.
We have already seen preliminary results from the stigma index survey indicate that there is an increase, more than double stigma related to HIV.
They warn that parts of the HIV law worsen discrimination and discourage testing, seeking treatment, and openly living with their status.
As Uganet, we petitioned the Constitutional Court to challenge sections of the HIV Prevention and Control Act that we think criminalize communities. The Constitutional Court decided, and we were not comfortable with the decision that they made, so we have launched an appeal and we have already filed it in the Supreme Court of Uganda.
We also are not happy that anybody who is arrested for any case, if they are tested for HIV, the case is aggravated. So we think it is a direct target on the people living with HIV.
Section 18, subsection 2E of the HIV/AIDS Prevention and Control Act permits health workers to disclose a patient's HIV status to people considered to be in close or continuous contact, including sexual partners.
It provides that a health worker is required to disclose the results of an HIV test, if it's a positive test, to any other person who is in close or continuous contact with an HIV positive person, without consent, by the way. And this is, of course, a serious breach of medical confidentiality. I go to do a health worker draws blood from me for a test, and then you are saying after I leave that clinic, that hospital, the next thing I learn is that the health worker is communicating to everybody he or she thinks knows me. And that's what the law provides. How can this be acceptable? How come even during COVID they were not disclosing people's COVID results? And why only HIV then? Why not any other infectious diseases?
Section 41 imposes a 5-year jail sentence or a fine not exceeding 12 currency points or both for attempted transmission of HIV. Advocates question how intention is established, especially where virus separation, scientific evidence, and other possible sources of infection are not fully considered.
Offense of attempt to transmit HIV, which is in section 41, when there are scientific issues that were not taken into account. From a scientific point of view, what constitutes an attempt? If a person has a low viral load and is not able to transmit HIV, if they are in sexual contact with another person who is negative, can we say there has been an attempt? When scientifically speaking, it's not possible. But the science in this area was not considered by Parliament. And of course, the courts of law will never consider it because it's not in their domain.
And we thought we had done a good job in moving the court to appreciate that the science around HIV had evolved, and therefore criminalizing communities was not needed as an effort to make sure that HIV is wiped out. But unfortunately, they did not believe us.
Because you are negative, and you don't know, or you know, then we go to a lodge, and you want me to be the one protecting you. Why? Preventing new infections should be a shared responsibility.
Sylvia Komhanj was convicted in 2019 over allegations of transmitting HIV to a child. She spent 2 years in prison before medical evidence cleared her. She says that her experience exposed dangerous misconceptions surrounding HIV within the justice system and the public.
Once you're suspected to be living with HIV, they should go further and investigate. They should not just decide there and then. Because now you see, in my absence, as I was in Kidepo National Park, they took their baby after suspecting, after seeing something, a swollen part in the baby's armpit. They took the baby for PEP. At least they would have taken time. They would have gone, maybe taken the baby to the doctor and they find out, but they should not have decided to give the baby PEP, because now the baby suffered for no good reason. And also taking me to police and I'm held there for 2 good weeks, no bond. That is not being fair. Casting me in prison, all those months, 9 months, no bail, no what, it's unfair really.
The thing that is distancing people from healthcare is the fear, is the stigma, is the discrimination around it. And the fact remains that punitive laws do not promote access. If there is anything they do, they distance.
Advocates believe the upcoming Supreme Court hearing presents an opportunity to replace criminalization with evidence-based public health approaches.
People should be treated equally. When somebody is suspected, treat them equally like any other normal human being. They should not just look at some people living with HIV as if they are criminals, treating them as criminals. Like you have already judged somebody, you judge somebody. You have not yet ruled the case, but for you have already. The actions speak.
We need to, we who are infected, you know, the fear is that the 1.5 million Ugandans who have the HIV are going to infect you. Some of you who even don't know your HIV status, that we are going to infect you, are out, armed and dangerous. This is the information that they have. But that's not the issue. So we need to talk more.
They note that disclosure helps dismantle myth, restores dignity, boosts self-esteem, and inspires more people to seek testing and treatment without fear.
Twagala nnyo abavubuka baveeyo boogere nti nina obulwadde era nkola bwe nti, kubanga bw'ovaayo n'oyogera kikuyamba, teweekweka tutodda wansi mu kitanda naye okijjayo bulungi. Era bannaffe aboogedde bwe batyo tubalabye nga bayambiddwa ng'era tebatya kufuna services.
So, but with the infections, about 100 new infections every day, we now have, for example, 4,700 babies infected annually. Criminal. And this is something that we really don't need a law about. These are things we need to talk about.
For many people living with HIV, disclosing their status remains a deeply personal decision shaped by fear of discrimination.
Or when I wake up as a woman living with HIV, we have disclosed without even telling our children and our families. And our children are now the ones bearing the stigma that we did not bear. Because when we did disclose, when we talked about the things, we were ready, we were prepared. But our children are not prepared, and they get in the school and then they are saying, this one's mother is HIV positive, and therefore he's also positive, she's also positive. And therefore, the trickle stigma that goes to your children, and they cannot be the same. They cannot live their lives the way they should be living their lives.
Currently, 300,000 people are not on HIV treatment. As Uganda strives to end HIV as a public health threat, not criminalizing those living with the virus could be the country's effective remedy to eliminate new HIV infections. Crispus Arinitwe reporting for UBC.